Welcome back. If you remember, in the previous lecture video, we classify periodontal disease progression by the degree of attachment loss. Grade 2 is defined as the loss of 25% attachment, while grade 4 is loss of 50%. But how do we quantify this factor? The answer is periodontal probing. Periodontal probing is the measurement of the depth of the gingival sulcus with a periodontal probe. Technically, you're not supposed to be able to probe the gingival sulcus because it's supposed to be shallow. In cats, this gingiva is very much attached to the tooth. So, if you're able to insert the probe inside, then there is a loss of the attachment of the soft tissue to the tooth. Let's discuss in detail. The periodontal probe, as seen in these images, is inserted into the gingival sulcus up to the end that you could measure. The depth of these periodontal pockets are measured in millimeters to evaluate the extent of the loss of attachment. The Williams periodontal probe, as seen in the image on the slide, has markings at 1, 2, 3, 5, 7, 8, 9, and 10 millimeters. This method is regarded as the cheapest and easiest way to accurately diagnose periodontal disease in the absence of dental radiographs. The results of periodontal probing is compared to the normal values of gingival sulcus depths. In dogs, the normal is only 1 to 3 millimeters, while in cats, it is only at 0.5 millimeters. In a patient at stage 0 or a healthy periodontium, the probe will only go to its normal gingival depth, as seen in this picture. However, in a dog or cat with periodontal disease, wherein these tissues become detached from the tooth, the gingival sulcus will be deeper, and expectedly, your probe would also go deeper. As to how deep, you will be aided by those markings we discussed in this periodontal probe. In patients with severe calculi deposition on the teeth, probing is done after the scaling since the pockets are still covered by all that calculi. You will not be able to insert your probe. The sequence as to your dental clinical workup would ultimately depend on your assessment of your patients. The periodontal probe is held with a pen grip with the middle finger, designated with the letter M, is placed on the edge of the probe. Support your hand with your ring finger while working inside the patient's mouth. This prevents any damage done to the gingiva by careless probing. Okay. Now, you have to walk the probe inside the sulcus, insert the probe, withdraw, and insert again a few millimeters away until you get at least 6 measurements. Then you get the average. Now that we have discussed the disease, it is time to discuss the procedure. Click on the next video to start.